Hello, friends. This is Katie Owens with the Healthcare Experience Foundation. This is three of three parts in our series to focus on the CARES behaviors in crisis. We're going to focus on the remaining 5 competencies to enhance patient and family communication using our CARES model. If you'll recall, we have the 5 key competencies to CARES that will consistently create patient-centered experiences. So we focused so far on confidence and anticipating needs. Now we're going to dive into respectful communication in our verbal and nonverbal body language, engaging the patient and family in care and process, and saying thank you or a safe transition. We want you to have this brief introduction as part of a larger skill set to support your mindset and toolbox as you manage the COVID-19 crisis. So let's look at respectful communication. Relationships are built on conversations. And we know in high anxiety environments, 93% of effective communication are through nonverbal message, in particular our body language and tone of voice. And we have to be so vigilant about this during this pandemic because there are so many physical barriers. We have PPE barriers. We have visitation practices that have changed so quickly. And so we have to convey a lot beyond the words we're saying. And so I would encourage you to do 2 things. The first, have a brainstorm or think to yourself, what are the words that we say that we need to banish from our vocabulary? The things that we've heard, and we've done this training with many leaders, staff, and physicians are things like short staff, not my patient. I have bigger priorities than this. What are all the negative words that stick like Velcro that harm trusting, confident relationships with our patients? Next, I encourage you to figure out what are the words and phrases that build the best experiences. We're going to take great care of you. We have an excellent team. This is one of the best places to be. We want to make sure all of our patients feel listened to. Brainstorm those and have those and grow in your vocabulary and say them time and time again. Because we have to make our caring visible. Let's look at engaging in care and process. Our world is so familiar to us. Sometimes we skip the step of helping the patient and their family member understand what is happening. And so we really encourage you to narrate every aspect of your care by explaining what you're doing and why. And when you have that limited time on the phone or over video conference with the family, to explain what you've done and to not leave off the why behind it. Thinking about questions to empower the patients to participate in their care. Saying things like, if at any point in time, what I'm saying is confusing, I need you to speak up. We use a lot of complex language here and things that we're familiar with that aren't always familiar to our patients. So I'm counting on you to call a timeout. Asking patients' opinion is really important to give them the permission to participate. And integrating engagement into your current work, your tools like your whiteboard, any rounding or shift change communication that you have with patients. And create forums for information sharing with the whiteboard and video conferencing. And some of the things that we focus on when we do this training is to be especially vigilant with jargon. Doing some exercises, like these are things that we have pulled off of whiteboards in health systems, that today's goal. And we know that OOB is our language for, of course, out of bed. Ambulate, we really mean let's just go ahead and put it out there. We just want you to walk. TID 3 times a day. PRN is needed. OOP, out of pocket. PCP, primary care provider. We have to speak their language. Let's look at safe transitions and saying thank you. As people form memories, That lasting impression is incredibly powerful. This is our moment to demonstrate caring, express gratitude, and ensure a safe next step. What do we want patients to remember us for and the care that they received here? We want to own that moment. And how can we then transition that relationship to demonstrate teamwork and continuity of care? Saying things like, I'm so glad Kathleen is your nurse this evening. She's one of the best nurses we have at this hospital. She's going to take great care of you. Thank you for the chance to care for you today. Or, Dr. Smith is an excellent physician. He is one of the most sought after physicians. He is going to be with you within the next 15 minutes. I know that you're going to find this wait important. When you can manage up that transition, it really creates that warm introduction to the next person. And CARES has helped organizations across the country improve safety, improve quality outcomes, improve patient experiences of care, reduce turnover, and reconnect to purpose. And so I encourage you to find the learnings in this as we approach COVID. And if there's anything myself or our team can do for you, please let us know. And just as a recap, have and project a really deep appreciation that despite all of the challenging times we're in right now, that you are helping people in some of the most stressful moments of their life. Many times their hopes and dreams are on the line for the future. And guide them through their visit, their stay, no matter how long the duration, and know that you have a remarkable power to demonstrate CARES. Thank you for your time today and for your service.